Welcome to the Day 3 of American Thoracic Society, ATS, 2024 Conference Update. Here we present the latest insights into adult sleep clinical core curriculum. But my watch says, wearables and sleep. Kurat Gill presented a study investigating the different types of widely available wearable devices for sleep monitoring. The study reviewed the performance of these devices, discussed potential limitations, and identified the role of wearable devices in clinical sleep medicine. The session discussed 3 different types of technology: consumer-grade technology, clinical-grade technology, and hybrid or transitional technology. Sleep wearables measures sleep score, women's health, fitness features, readiness score, etc. Most devices are not validated against polysomnography, and even algorithms are proprietary for validated devices. The session highlighted that clinicians should be aware of the different types of CSD, their MOA, FDA oversight, and supporting evidence, if any, and highlighted that more research is needed to ensure accuracy and reliability of these devices. New therapeutics on the block: hypersomnia disorders. Srilatha Nayak presented her work on the medicines that best aligns with individual patient needs for hypersomnia disorders. The session highlighted that lower sodium oxybate is currently the only medication that has regulatory approval for the treatment of idiopathic hypersomnia. The central disorders for hypersomnia are narcolepsy type 1, narcolepsy type 2, idiopathic hypersomnia, and other disorders. The session highlighted the role of modafinil and armodafinil, which works by inhibiting dopamine uptake, and USA FDA approval for narcolepsy, OSA, and shift work sleep disorder. Solriamfetol inhibits dopamine and norepinephrine and FDA approved for narcolepsy and OSA. Pitolisant is a presynaptic autoreceptor that inhibits histamine release and is approved for narcolepsy with and without cataplexy. Flumazenil binds with alpha and gamma subunits and improves sleepiness and psychovigilance. Sodium oxybate is approved for narcolepsy with and without cataplexy. The session highlighted that while choosing medications, thorough patient history needs to be checked. Desired outcomes should be balanced with side effects and help patients reach their clinical goals. Put on your thinking CAP: the latest evidence in community-acquired pneumonia. Chiagozi Pickens from Northwestern University presented a study on the latest evidence regarding the diagnosis and management of community-acquired pneumonia CAP. She discussed the evidence on CAP diagnosis and management, applied this through case studies, and discussed new diagnostics and antibiotic stewardship. Steroids can help reduce mortality in severe CAP cases. The session summarized that empirical antibiotic therapy for CAP should cover common bacterial and viral pathogens. Diagnostic tests, including nasal swabs for MRSA and multiplex PCR, can guide antibiotic escalation. Shorter antibiotic courses, minimum 5 days, are effective for CAP if clinical stability is achieved. Steroid therapy may benefit patients with severe CAP, but individual patient factors must be considered. Cough it up: infectious causes and complications of bronchiectasis. Beth Shoshana presented a session on bronchiectasis. The session highlighted that bronchiectasis involves the impaired clearance of mucus and trapped particles in the airways, leading to inflammation and further damage. Patients often present with productive cough, fatigue, and recurrent infections. Management focuses on improving airway clearance, which is crucial for reducing exacerbations. Options for airway clearance include manual percussion, positioning, breathing exercises, and mechanical ventilation. For severe cases, long-term antibiotic therapy and potentially lung transplantation may be necessary. The session highlighted that it is important to consider individual patient factors and the extent of disease when determining the best course of treatment. Atypical situation: what's new in the world of non-tuberculous mycobacteria? Ashley Jane Lozer presented a talk on non-tuberculous mycobacteria pulmonary disease, NTMPD. The talk highlighted NTMPD is increasingly prevalent worldwide, with risk factors including genetic predispositions, immunodeficiencies, sex, low BMI, and age. Diagnosis and treatment follow ATS and IDSA guidelines, focusing on common NTM species and requiring careful consideration of potential side effects from medications like antibiotics, which can cause issues such as QTc prolongation, GI disturbances, and neuropathies. Monitoring includes regular sputum cultures, CBCs, and vision/audiology assessments. New treatments are emerging, including inhaled nitric oxide, mycobacteriophages, and inhaled molgramostim. Surgery and lung transplantation may be options for selected patients. The talk highlighted the advancements in NTM-PD treatment and diagnostics are promising, emphasizing the importance of individualized patient care and ongoing research. Thank you for tuning into ATS 2024.